Kalima kuwawa ngati ningalyanga wakaine hayoye. Ninga wanamka mwana ninga pura yai, kunkuni ninga yako yai, mwana wane machona wanda tule yai, pali cheka weni, pali pose pakubaba. Ninga wanamka mwana ninga pura yai, ne kumachi ninga yako yai, mwana wane lusungu wanda kule yai, pali cheka weni, pali pose pakubaba. Anyamoyo wadandaula, anyakondwe wadandaula, anyamoyo anyauntali wadandaula, anyachere wadandaula, anyamoyo visukulu ninga pula yai, kutambo ninga yako yai, mwana wane temba wanda kule yai, pali cheka weni, pali pose pakubaba. Ninga vana visukulu ninga pula yai, ne kumachi ninga yako yai, mwana wane lusungu wanda kule.
So I think I understand that Gunther, our CEO, who's hoping to give a couple of remarks remotely, is not able to connect. But I will go ahead and
coming up on theater.
Start my own soundtrack. I just want to talk a little bit about the One Family Health model, kind of give a high-level overview, and then talk a little bit more in detail about our impact and how we work with our nurse franchisees. And I think you'll hear a lot of similar themes to what we've been talking about today. I've sort of been furiously making notes about all the connections to things that the panelists have said. So thank you for the opportunity to talk a little bit about our model. One Family Health is a nonprofit organization. We started operation in Rwanda in 2012, and we operate as a public-private partnership, as Krishna said, with the government of Rwanda. One Family Health is building a franchise network of clinics across Rwanda. Under the public-private partnership, we have a goal of opening 500 clinics, and that is in support of the country's Vision 2020 framework, which sets an objective to reduce the travel time to the nearest health post to less than an hour. Rwanda is a small country, but about 80% of the population live in rural areas, so access to health services is still a huge challenge. As part of this public-private partnership, integration with the government is really critical to our model. So our clinics participate in the community-based health insurance fund, and we're actually considered official entry point into the public health system. So we're really different than a lot of the private sector approaches that have been, piloted elsewhere, in that we're really trying to complement the existing system and work with the government to expand access. Moving on. Partnerships are really critical to One Family Health's success, so I just wanted to talk a little bit more about the roles and responsibilities under our PPP. So One Family Health, well, we're indirectly responsible for the initial clinic investment, and that's through the financing partners that we identify, and also through the franchisees who do pay into the clinics when they start a franchise. We do all of the franchisee recruitment and training. We provide a lot of financial and operational support. Monitoring and quality control is, a critical activity. And then there's a lot of coordination with local and district officials. You might have seen a little bit in the video about, just how many people are involved, and I think you got a sense of kind of from the federal level all the way down to the local and cell officials. So coordination is a big part of our daily operations. The government of Rwanda has a couple of key responsibilities. As I mentioned, the reimbursement through the Community Health Insurance Fund is critical to our business model and provides the revenue stream that enables us to keep pricing, keep care affordable to the rural populations that we serve. Again, the integration with the public health system at the community level, the franchisees work with community health workers. That relationship right now is a little bit more informal, kind of happening from clinic to clinic, and we're sort of building towards standardizing that a little bit more, but there's a lot of close collaboration with the district level health facilities. And the government also provides the physical space for the clinics, so they're identifying existing facilities. We're not building new spaces. There's usually some renovation that happens, but that leveraging other resources comes to play there. And then, as I mentioned, our financing partners, some of you saw some of the logos during the video. GSK was our initial funding partner and has provided a significant level of investment to get us to where we are in Rwanda today. EcoBank provides our loan financing facility to our franchisees. So these are some of our key partnerships. Krishna had also suggested that we talk a little bit about learning and sort of our origins. One Family Health spun out of an initiative called the Child and Family Wellness Clinic Network, which was launched by the Health Store Foundation in Kenya. So gives us about 10 years of extra experience that we're drawing on, having launched One Family Health in 2012. And so the child and family wellness model operationally is fairly similar. There are small clinics, part of a franchise network, and they're focused on sort of primary level care. But on the sort of the broader scale and the partnership model approach that we have taken is really very different. So One Family Health is, as I've mentioned, working closely with the government, really trying to engage and complement what the public sector is doing. And part of our approach also has to do, again, with the financing and with our sort of overall business model. We operate, our subsidiary in Rwanda actually operates as a for-profit entity, and we do expect it to be financially sustainable. We haven't quite gotten to that level of volume yet, but we expect to hit sustainability at the country level at about 250 clinics. So if we reach our goal of 500, the operation will be self-sustaining. And we found that this approach with the government support and the sort of different approach to financing, that our growth has been faster than the child and family wellness clinics. Now, having talked a little bit about the model, I did want to focus a bit on some of the areas of impact, which have been a part of the discussion so far today. Women's empowerment is a really big part of our impact, although it's not one, quite frankly, that we have really measured. We haven't conducted a lot of research to measure it. We are launching a survey right now, sort of a multi-stakeholder satisfaction survey. So we hope to capture some indicators of empowerment of our franchisees. But so the direct empowerment of owning your own business is certainly a key outcome that we expect to see. And I think Marla was talking about the sort of wraparound effect also of these entrepreneurs being able to then employ other women. So we're now at about almost 100 clinics, but the total employment across the network is about 350. That includes some other nurses being employed, but also your sort of administrative assistants and cleaners and other assistants around the clinics. Again, the majority of whom are women. And then I think we've also heard a little bit today about the sort of role model effect of female franchisees in rural villages, being an example of female business owners. The improving access to quality care is another critical part of our model. I think Krishna was talking about standardization, and that's part of the focus of a franchise approach is to really standardize care. We offer a intentionally limited menu of services across all of the networks to reduce the complexity, to streamline the protocols, and that helps us keep the quality standards higher. Of course, reducing the distance that people are walking to clinics is a huge and measurable impact that we've had. We're working together with the government to sort of prioritize the site selection. So we've targeted areas first where, as illustrated in the video, people were walking more than 20 kilometers and it was taking more than 3 hours to get to a health system. So that's where we've started. A little bit of what we treat. The majority, sort of the most treated conditions are what you might expect to see: respiratory infections, malaria, diarrheal disease, a lot of deworming. And then strengthening health systems, another important topic today as we work with the government. We're really trying to allocate resources a little bit more efficiently, having people be able to go to a local health post. That's sort of the official nomenclature in Rwanda for our level of care. Decreases the burden on reference facilities, and overall we're bringing down the total cost of care for the system. And I did want to talk a little bit more about franchisees now, but in terms of the health system contribution, the training, ongoing support for the franchisees and additional training, especially around demand planning and sort of the business operations, we feel makes a contribution to the system there. So to focus a little bit more on our relationship with the franchisees and sort of their role within the organization, we do recruit nurses who are already experienced and are at the level where they can deliver in theory, deliver the care that our clinics provide. There is always, some initial training to make sure that everyone is really at the same level and to go over our standard protocols. Nurses do contribute an initial down payment of about $500 to buy into the clinic franchise. And with that down payment, they're given access to financing, so startup loans again. And we've talked a little bit today about how that's a barrier for many entrepreneurs, and particularly female entrepreneurs. Nurses also benefit from the sort of operational and business support that comes from the head office. I've talked a little bit about what that is, and in Rwanda, with our model, a huge burden is actually coming from the claims processing. Rwanda's health insurance system is truly a community-based health insurance system and is administered by more than 400 local offices. This has been a challenge for us organizationally. We continue to learn about how to improve that reimbursement process and accelerate the repayment of claims. So that's been a learning opportunity. Ongoing, I think I've talked about most of these points, ongoing training. We also provide an electronic platform, which provides clinic management and a patient electronic health record. So training and support for the franchisees around that technology is an important part, but it is designed, to be a pretty simple, smartphone-based application. And finally, I think, the participation in a network is a really valuable source of support and learning for the franchisees. Certainly some come in and drop out. We don't have a 100% success rate, but our success rate is very good with retaining franchisees. And these are nurses who, in most cases, didn't have any business experience before. So I think it is, to some degree, a testament of the model and the support that's provided, certainly also a testament to their strength and perseverance. And I think the last slide, I just wanted to talk a little bit sort of about where we are in the way forward for One Family Health. As I've mentioned, in Rwanda, we are continuing to expand and building towards our goal of 500 clinics. We are continuing to work on a couple of the challenges we've faced, and again, the biggest is the claims and reimbursement process. And finally, of course, continuous quality improvement is a focus. We're also starting to look beyond Rwanda. We're in various stages of planning for expansion in Nigeria, Ghana, and Zambia. And I wanted to note that, One Family Health has think was one of the original class at member class of IVIHD, and so it's been a really valuable resource for us, and providing, just some of the things that Krishna mentioned, the opportunity to learn from other innovators, the opportunity to connect with more resources around financing. I was a Duke student that he mentioned, they like to put us to work. And so that's how I got to know One Family Health and now have come to work with them. So it's been a great opportunity for me as well. And I think I will pause there. We'll close with a quote from one of our entrepreneurs who talks about the opportunity to be a franchisee really having both personal and, I think, much broader value for them. So thanks very much for your time.